executive when the Cincinnati-based hospital system merges with a Maryland-based health firm this fall. John Starcher will take the helm of the combined Mercy Health Bon Secours system.
John's worked very hard to get to where he is. He was not born with a silver spoon in his mouth. He's done a little bit of everything. For example, at his years at BG, he was a diesel mechanic and drove a bus. Sort of a self-made guy, I think is how I describe him. John had the benefit meeting a professor. One of them was COO at Medical College of Ohio in Toledo and offered him a fellowship at MCO. And that changed John's life. It prepared him for work and prepared him to work in such a way that it makes a difference. He was in our HR department at St. V's, was promoted to our chief HR officer at the system level of Mercy Health, to divisional or regional CEOs. He's just grown steadily throughout the years. And is just an extraordinary leader.
And during his time at Bon Secours Health, John has been an advocate for justice, displaying a commitment to the tenets of Catholic social teaching and hiring practices, training, and community outreach. And he expanded Bon Secours' care network and ensured that the ministry stays on the leading edge of innovation while caring for patients.
He refers to the work that he does as a ministry. He leads a very large, not-for-profit, mission-driven organization. There are 60,000 employees, 48 hospitals in 7 states in Ireland. So you can imagine the complexity of a system like that. I've always said that when you lift up the hood on health policy, most people do not understand what they're looking at. John understands what he's looking at when he talks about health policy, and that has really caused him to be a go-to person for a lot of very high government officials who want to do the right thing in healthcare. So his ability to kind of understand what the complexities are and then to have conversations with people who may have less understanding but really trust him to counsel well on pressing matters of health policy.
I have a firsthand example that maybe really shows it best. And that is my wife and I unfortunately lost our daughter at 24 years old. My wife and I decided to start Maddie's House, a nonprofit to help other young adults. John realized that we were making a difference, but we were, as I like to say, the ragtag Raleighs working out of a storefront. And while we were reaching a few dozen people a month, John realized the impact that what we were doing could be if it was given a chance to flourish. So he and Bon Secours Mercy Health decided to donate a rather large home that we had a chance to renovate. And because of that one single act, we are reaching a couple of thousand to 3,000 people now a month who are young adults. John wasn't thinking of us so much as he was looking at the greater good that could be done if he lent a hand. So as a result, because of his actions, there are thousands of people in the greater Cincinnati community who are now getting the help they need that otherwise wouldn't have it. And quite frankly, it wouldn't be but because of John's vision. And it's one of the things I admire most about him. He can see to the future. A lot of folks can't see that, how to help and how to get directly involved and take a chance to make something better.